I've had poor eyesight really for as long as I can remember. I started wearing glasses when I was 10 years old, but my sight must have been poor before that. I've always hated being outside in the rain with glasses on. I hate it when they steam up. I hate playing sport in glasses. So they were never a positive part of my life. And I tried various times to have some sort of surgery to my eye. However, I had a retinal tear in my eye, and that was through playing sport. And I think that was one of the big things that most people didn't like in terms of doing any surgery at all on my eye, as well as the fact that I was quite short-sighted. So I know in terms of laser surgery, I was outside of that range that made for high rate of success with the surgery. I returned to a very good optician I used to use in Hereford and asked for a very thorough check. Nothing wrong with my eyes, and she said it could be helped with glasses, but these would be really expensive glasses to do this. The lenses would be Zeiss lenses and would cost a lot of money. So she asked, had I not thought of any surgery for my eyes? She referred me on to Simon, and it all moved quite quickly from there. Simon did various tests. None of those were very, very different from what I've had in the past. And quite surprisingly, I thought was relatively optimistic that there was a chance something could be done. So he went ahead with the first lens, which was a toric intraocular lens, because I have quite a large astigmatism on both eyes. I know they're not easy prescriptions. That was a very simple procedure. I felt very fully informed about what was involved. It was a very simple day procedure, turning up at the Nuffield, having everything explained what was going to be happening to me, signing the relevant forms, which were explained to me, and then having drops administered so that the local anaesthetic was administered directly to the eye. That carried on for about an hour or so before I then went through for the very simple, well, it seemed simple to me from my side of the sort of operation surgery that was done. It was quite painless, very easy to tolerate, very quick. I think I was in there for about 20 minutes. I had no sort of sensation at all. But the amazing thing for me was to realise within hours that sight was going to be quite good, and certainly after a very comfortable night, the next day was quite amazing to wake up and open my eyes and see, and I can still remember how good that felt. I had a phone call from Simon during the morning to check up on how I was, and that was really appreciated. And I think he could know just by the tone of my voice that everything was going very well. My sight was amazing. I have better sight in my right eye than glasses or contact lenses could ever give me. The left eye, I know, was a trickier eye to do because of the retinal tear, and precautions were made because of that. And so that one was done at the county hospital rather than the Nuffield, in case there were complications coming following that. There were no complications from my view of it all. The operation was as successful as the first eye and ran as smoothly as that, with a very similar process being used. The other thing that this has really transformed my life is with sport as well. I'm no good at sport and probably never will be, and most of that's because I refused to wear glasses when I was a teenager and couldn't see. But now I just enjoy it very much, and I spend a lot of time on the tennis court, and I have great vision and love it. Can play in the rain very happily because I don't have that uncomfortableness of rain over glasses. So it's just been absolutely brilliant for me. I also don't have my grandchildren pulling off my glasses all the time, which is a great delight as well. I've already recommended both the procedure and Simon Madge to friends. In fact, a friend here has already had it done. She's already seen Simon. I think she was quite inspired to try and change her life as mine's been changed by it.